Well, studies show that if you smoke, you are twice as likely to develop a condition that can rob you of your eyesight. Dr. Ralph Chu, medical director of Chu Vision Institute, joins us now with more on age-related macular degeneration. Thank you so much for joining us.
Thanks for having me.
This really is something we should pay attention to, because if we're smoking, this is kind of down the line. You don't think of things as you're going through it in your 30s. You hit your 50s and beyond, it's not good.
For sure. It's one of the biggest risk factors for developing this degeneration of the central retina that affects your ability to see faces, drive, and read as you get older.
My dad had this, and he was diagnosed probably in his late 60s. And so I know that he was very frustrated with that. So there are certain things that we can do. Who's at risk for it, by the way?
You know, it's very common with age. Age is the #1 risk factor. So in our practice, we see a lot of cataract patients who also have some macular degeneration. So aging is the #1 risk factor for developing this.
Okay. But you don't want to be smoking either. Here, so let's go on to what are the 5 ways that we can prevent it?
You know, the #1 thing we talked about was quit smoking, but then also generally having a good lifestyle. Eating healthy foods that are high in omega-3s help protect the retina because of the antioxidant effects. For those of us who have trouble controlling our diets, basically using supplements has been shown to really significantly reduce the risk.
Okay.
You know, so you have a supplement here for AREDS 2 vitamins help significantly, 25% reduce the risk of macular degeneration.
This is the one you were talking about that you really like a lot. So it's got vitamin C, vitamin E, zinc, copper, and a bunch of things in it.
Yep. And then this other one, the new product out there is a medical food. So it's between a vitamin and a prescription drug. And this actually helps increase the protective pigment inside the eye. And we can actually measure that with a device in our office.
No kidding.
Yeah. So things are improving all the time.
Okay, so we're talking about the foods, we're talking about other things that we can do. You also have some technology that if you do have it, you're now able to do something about it.
Yeah, so the treatments keep improving. I mean, there are, you know, surgical interventions where you get injected to kind of reduce the significant side effects. But one of the cool things we have is this implantable telescopic implant that helps improve the central vision for patients.
Here's a little video of it right there.
And you can see how small it is. It just sits right on the tip of a finger, and it helps expand the central vision so patients who couldn't see to read can now scan and maybe go to the grocery store and read prices again.
So basically, are you creating a flap where you then slide that inside the eye?
This is actually like a cataract surgery. So you actually can remove the cataract from a patient and then actually implant this to help improve their central vision.
Wow, and so they really go from having very distorted vision in some cases to being able to read. That's just amazing.
It's an amazing time in this. There's such a growing need as the baby boomers age. You know, they're estimating about 60 million patients potentially getting this by 2030.
Is this covered by insurance then?
That implant is actually covered by insurance.
Okay.
Yeah.
Thank you so much for coming
Thanks
and
for
visiting
having
us
me.
today and telling us a little bit more about this. All right, for more information on what we just talked about, just head to KARE11.com.